Okay, so we're sitting here with Jennifer, who is 1 month out. She just came in for her follow-up, and I thought it was important to get a little impromptu interview because she's doing incredible. And I think it's important to show this symptom sheet. When our patients come in, we have them fill out a symptom sheet. I always say, at least when I was sick, that was my validation. So these are her symptoms at the day of her consultation. And then we have the patient redo it when they come in for their 1 month follow-up. And this is what that sheet looks like today. So I like to do the comparison so we can see, you know, the saying gets used way too much, but it's so real. The heel is real. So we're gonna just talk with Jennifer a little bit, see how she's doing, and I appreciate you talking to us. And tell me how you're doing and what has changed and what still needs to be tweaked.
I feel like I'm doing good. I'm anxious to get back to my normal activities. It's interesting because I remember filling out the form in the beginning and having all the things that I checked off, which was overwhelming. But then filling it out today, I was kind of like, oh yeah, I forgot. Like I haven't had this happen since, you know, I had my implants removed. So going through today, I was like, oh yeah, I haven't had that. So that's reassuring. There's a few things that are still happening, but I feel strongly that they'll get better. My ringing in my ears. I still have some muscle twitching every now and then, but there's been an improvement. I like the swelling I used to have is gone. The choking, like waking up in the middle of the night choking, is gone. Not getting up in the middle of the night to go to the bathroom is wonderful. I get a full night's sleep. My heart palpitations, every now and then I'll have a faster heart rate, but not like it was. So I think that's an improvement overall. I'm not having to take medicine as often as I used to. I used to have to every day. And I think maybe I have 3 times since I've explanted.
So on that topic, that's amazing. I mean, we really can't make this blank up. On that topic, we have an amazing resource named Mandy Lynn, and we are going to get her in touch with Mandy so she can work on the detox. Sometimes it's just a little bit of a tweak, but within that month, I mean, you still have healing. You're only a month out, but just to kind of help you along a little bit with maybe the ringing in the ears, the bloating you had said, you still have a little bit of stomach bloating, and that could be food related. We are very, very sensitive. It's definitely a gut-brain connection. So Mandy will definitely be able to help with that. So we're going to continue to follow your journey. And we are so excited that you're doing so well. And thank you for being willing to take this kind of impromptu. I think it's important that patients that are on the fence, you know, what if I don't get better? What happens? Every body is different, but to have testimonies like this after a month, it really does encourage the women to know, you know, what have you got to lose?
I think for me too, I had implants. I've had them replaced multiple times due to deflation. And I had it in my mind that I wanted them out, but then I went down the rabbit hole per se. And when I started researching Explant, I started learning about bilateral implant illness, and I joined a Facebook group and learning that there's so many other women that have, and I have all these things, and I'm like, oh my gosh, when these come out, I can get rid of all of this, you know? So to me, that was really a motivator to want to do this. So
and there really are patients, and thank you for that. There are patients that'll look at that sheet and they say, it's all filled out if one symptom goes away. At least we've eliminated that. And they are pleasantly surprised of how 70-80% of these symptoms do go away. And, you know, and what lingers is, you know, just a little tweaking. Again, you have 3 sets of saline implants with many deflating. I think I believe you had every single time they deflated. So, you know, sometimes the journey is a little bit longer than we would like, but to look at that, we'll take it. And just to get your joy back, and you're back in the gym. One of our questions was today about being able to lift like some crazy weight, and we're like, Dr. Pryor's like, go ahead, you go, girl. So she's definitely getting her life back, and we're anxious to continue to follow her journey. So thank you again for talking to us.
Thank you.
You're welcome, honey. Good job, babe.